Just yesterday, the Food and Drug Administration extended authorization for that Pfizer vax for kids aged 12 to 15. The Iowa Department of Public Health estimates this is going to make roughly about 167,000 adolescents in our state eligible to be immunized. We know a lot of you have a lot of questions about immunizing children. Is it safe? What about kids younger than age 12? You may have seen numerous claims on social media regarding vaccines both for children and adults. Our political director, Dave Price, joins us this half hour. So does state epidemiologist Dr. Caitlin Peddotti. Dr. Peddotti was a pediatrician before joining the state's medical team. And also joining us live via Zoom, Dr. Patricia Winokur. She is the executive dean of the Carver College of Medicine at the University of Iowa and professor of internal medicine and infectious diseases. We really appreciate all of you being thoughtful and intentional on receiving this information this hour. We're going to try to get to as many questions as possible. Dave, why don't you kick us off?
Yeah, we have several hundred to get through. That we'll have to talk really fast. Let's just set the stage. We unscientifically did a Twitter poll to see where people are on this concept of vaccinating these adolescents, 12 to 15-year-old, after the FDA authorized the use of the Pfizer vaccine. And here's what you told us. About 57% of you say yes, you would vaccinate your child. About 30% said no, 13% still making up your mind at this point, Dan.
So you hear those numbers, Dr. Peddotti. Does that give you concern? We're all striving for herd immunity. What's the target number? And when you see that, do you think there's a chance we achieve it?
Yeah, that's a great question. So we've talked about this idea of herd immunity, right? Which means how much of a population do you need to be immune to something so that it can't effectively move between us? Now that number is going to be different for different illnesses. We're still learning more about COVID, and so we don't have an exact number for that. There are some estimates that put it around 70 to 85%. But the bottom line is we're headed in the right direction every time we encourage more and more Iowans to take advantage of preventive tools like a vaccine. And the great news is that now we have a new tool with Pfizer for kids aged 12 to 15.
But Dave, as we've seen, boy, did the brakes get pumped hard on people being willing to get the vaccine.
Yeah, and of course, as you would probably point out, we have so many people who've already had it, so it was bound to see the demand taper off here as you're getting 60% or so are people who have had at least one shot here. One of the things specifically that we were seeing with people's questions about the concept of vaccinating children would be the concerns about, is this safe? So we're going to try to roll through a bunch of the questions that we saw here. Amber had posted on Facebook, nope, never will, and will tell everyone not to let their kids be test subjects. And Dr. Peddotti, Dan and I saw numerous questions here about this concept of we're going to make our kids guinea pigs by giving them a shot. So how do you respond to that?
Yeah, so I think I would start by saying having questions about health, about vaccines is great. We want people to have questions about their health. We just want to make sure that we encourage people to go to trusted resources and good resources that have accurate scientific information to help them make those healthy decisions. And so I understand when there's hesitation about something that might be new, but there's a lot to think about that's gone into the development of these tools that began even before we recognized this virus. So the development process for these vaccines has been very rigorous. It's gone through the same kinds of safety and efficacy trials, work that Dr. Winokur and our colleagues at the University of Iowa were part of, and many others here in Iowa, to help make sure that we follow all the same safety practices to make sure that these are great tools, not just for adults, but for our kids as well.
I'm so curious how Dr. Winokur responds to this too, because one of the criticisms out there is that these vaccines are being used under emergency use authorization, not the full authorization of the FDA. Dr. Winokur, is that some of the pushback you're getting, that it's only the emergency use? And how far off are we until we can say these have the full-blown green light from the federal government?
So that is an issue that I have heard from others. I agree with what Dr. Peddotti said, which is we really put a lot of effort into testing these vaccines for safety, and many of these vaccines were tested for years before we even had COVID-19 in other viruses, but that gave us a lot of information about them. We are very close to having the Pfizer vaccine approved under full FDA approval. Pfizer is starting to submit their data right this very moment to the FDA for full approval. And so that should help alleviate some of the concerns. But I will tell you also that FDA has a huge advantage now with this particular set of vaccines, because usually when they're doing full FDA approval, they're testing maybe 3,000 people and following them for 6 months before they will submit the data to the FDA. Think about what FDA now has and what we've seen in the United States. We have not only done trials that are 30 to 40,000 people in those trials and followed them very, very carefully, we now have hundreds of millions of doses that have been given. So we have more safety data on this vaccine than we have on almost any drug that we approve through the FDA process.
That's a really interesting point. The acknowledgement that what's been tested out there before it was given the emergency use, on top of that, you got hundreds of millions of people now.
Another question here, Dr. Pedati from Jeremiah. He also has some initial hesitancy here. Jenna had it, Stephanie had it, Jeremiah has it here. He's saying his point is that in his mind, healthy kids and young adults don't have much of a chance of having serious implications from COVID, so why take the risk at all of using a new vaccine?
Yeah, so I understand that it's hard for people when we say we want to take somebody who feels perfectly well, and we do this in pediatrics pretty routinely, right? And introduce pieces of a virus, but it goes back to the point of trying to prevent somebody from ever having to get sick and ever having to worry about how to manage that illness or some of the long-term consequences that can come with it, which we don't yet know about the COVID virus. Unfortunately, we are seeing some people who are experiencing longer-term side effects from the virus and infection itself. And so in an effort to make it so that you don't ever have to worry about that, taking advantage of the vaccine helps protect yourself, helps keep kids from having to worry about those long-term effects or serious illness, which is rare but can happen in children. And on top of that, helps reduce the likelihood that this virus can continue to move through our communities.
Are you seeing cases of kids getting it, maybe not knowing it, and then spreading it to more vulnerable folks? Has that been proven to happen?
Yeah, so while kids haven't represented a significant source of transmission thus far, it's certainly possible for kids to get this virus, right? And the goal with this pandemic from the beginning was to reduce this virus activity, protect our vulnerable populations who are going to have poor outcomes, and preserve our healthcare resources to be available for all the needs that we have here in Iowa. And so everything we can do, including offering an important preventive health tool to kids to help protect them, is going to further that goal and get us closer to normal.
If I may get personal here, you got vaccinated?
I did, yes.
So that means you believe in this stuff,
I did. I am vaccinated. It's the recommendation I have made for Iowans, the recommendation I make for my family and friends. And I have these same conversations and questions with people both personally and professionally. And it's good to have questions about your health as long as you're getting good information to make those decisions.
Speaking of recommendations, that goes into the messaging we're getting from our public health officials. Dr. Winokur, I'm curious what your assessment is of how the message has been made. Obviously, if it's not being received to the degree that it needs to be received to achieve herd immunity with enough people getting the vaccine, how do you think it needs to be tweaked? What should people be hearing versus what they have been hearing?
You know, I think that Dr. Pedati gave the right information, as we need to provide information in a lot of different venues that's the accurate information so that they're hearing it over and over again and they're hearing really accurate information. I think people are coming up with interesting information that they're finding from untrusted sources, and we need to keep trying to counter that with opportunities like this to get out the right information.
The right information. What a novel concept. We're going to talk more about that in our next segment. Please stick around. We're also going to talk about some of the long-term side effects from the vaccine that Dr. Patati brought up, and also dealing with some lingering symptoms from the vaccine itself. We'll address these concerns right after this.